diminishment in their sense of smell.
I mean, that's possible, but I haven't had any experience that, dramatizes that. So
Okay.
I've noticed it.
Wonderful. And if you wouldn't mind just moving your head back and forth so I can see you've got that range of motion.
Okay.
Wonderful. And stick your tongue out for me. And these are all some of your cranial nerves. Wonderful. Nice and pink and moist. Do you still have all your own teeth, sir?
Yes.
Very good. I'm going to just feel for your lymph nodes. And I see your trachea is here right in the middle. That's what we like to see. How about any issues with your hearing as you've aged?
Not that I've noticed, although for 10 years or more, my wife tells me I don't hear very well.
So often, that's what wives say. I hear that all the time. Okay, how about earwax? Any issues with earwax?
Yeah, I do have periodically, maybe every year or two, my ears get stuffed up with wax. They have to be cleaned out.
Okay, okay. I do want to take a look if you can stick your tongue out all the way. Do you have your tonsils? Well, good, because I don't see them, so that tells us they're not in there. All right, you can go ahead and close your mouth. Can you do me a favor and repeat this motion that you see me doing? Very good. And that's another one of the cranial nerves. You can just relax. Now I want you to reach out your hands. This is more part of the neurological exam. And I want you to grip my hands, both of them, as hard as you can. Very good. Very good. And while I've got your hands in mine, I'm going to also go ahead and check for circulation by pressing the fingernail beds and making sure that they refill quickly. I can feel pulses on both sides and they're equal and strong. You can just relax. Now I'm going to go down to the feet and just hang your feet next to each other. And what I want you to do is press down on my hands as if you were pressing the gas pedal. Very good. And now pull up on them. Wonderful. And now you can just relax. And while I'm down here, I'm going to feel for your pedal pulses. Any issues with your feet that you notice? Okay. And I can feel pulses here. And your skin is nice and warm. And checking capillary refill again. I don't see any edema, so that tells me all the fluid that's coming down to your feet is going back to your heart, which is wonderful. All right. Very, very good. So, how often do you go to the dentist?
Twice a year.
Okay. All right. As I'm looking at your head, I'm just making sure that it's sitting right on the top here, nice and round. Have you fallen recently? No falls? Good. And I'm noticing that you have some of these, people call them skin tags, and that's very common. Usually we see them around where our shirt is or the waistband, where skin just kind of rubs up against something chronically and you develop a little tag. Do you see a dermatologist with any frequency?
Yeah, now about once a year.
Wonderful. So she or he can assess, because you also have some moles and freckles that I'm noticing. I don't see anything that concerns me right now, but it's definitely something that you want to get looked at and checked. Okay. I've already listened to your heart and lungs. We felt the pulses on hands and feet. Do you ever have any dizziness when you rise, when you stand up?
Not usually.
Wonderful. All right, well, what I'd like to do now is have you just lay back, especially since you have had colon cancer. I want to do a careful assessment of the gastrointestinal. So if you want to just lay back, get yourself comfortable. Okay. And so the first thing I'm going to do is just inspect the abdomen. Not going to touch it, I'm just going to look. And I see you do have this midline scar. Any issues with that? Is that from your surgery?
Yes.
Good. And what I want to do now is I'm going to listen and see where I hear bowel sounds, and do I hear them in all four quadrants or not? So in terms of your gastrointestinal health, what is your pattern in terms of bowel movements?
Well, it's typically